Anyway, so next week, next Thursday, 27th of June, a long-awaited program about health care in Hawaii, the Affordable Care Act, which we covered last year, and we said last year there was a transformation in process. Well, this is kind of it's a snapshot, a status report on how that transformation is doing.
That's right.
From some of the people who were there last year, but others too, to see exactly how this was going to affect us in various walks of life. The doctors, the hospitals, the government, what is the government doing? And of course the insurance companies like HMSA and people like you and me, patients, who really care about staying alive.
And small businesses.
And small businesses. That's probably the most important one of all, because Hawaii is built on small businesses. We have representatives of all those constituencies on the panel. It's a panel of 6, strong panel, and the moderator is really strong, Ginny Pressler from Hawaii Pacific Health. And I attended a meeting that you set up just to see how they were doing, and it was really vital. They're excited about this program. They got a lot of ideas, and they got a lot of questions that they're asking each other, but I expect that our audience is going to have more questions still. One of the key words from one of the speakers was confusion. We asked him for a word. His word was confusion. I thought that was really interesting because, there is a fair amount of confusion. Now, a year later, after the transformation has ostensibly begun, we have confusion.
Right.
And we have to dispel the confusion. This program hopefully will dispel the confusion.
People were sort of in the clouds. I mean, we had a new organization that was just getting formed that's supposed to be concerned about outcomes and data collection. We had a physician who will be back again this year who is concerned about the paperwork. The physicians want to spend their time treating patients, not filling out forms. And I don't think there was much thought being given to actually how the Affordable Care Act would be implemented. And now here we are a year later where the rubber hits the road. And it's going to be implemented whether we like it or not. It's here, it's coming, and I think there are going to be a lot of challenges. Well, I think the medical care industry is sick anyway.
Mm-hmm.
I mean, we have a large percentage of people that have no coverage whatsoever. The insurers that are covering the generally healthy population, which means the younger population, they love it when the chronic diseases show up when people are Medicare eligible, and the government has to pay for that anyway. In fact, as you know, most really critical health problems happen post-65 among the elderly. Are there alternatives? I mean, now the government's saying you've got to get health insurance no matter what. Maybe the medical savings account is an option for people so that they can save during the good years when they're healthy and be prepared when things turn south as we get older. So it's a lot of interesting problems to solve. Hopefully this will be a step in the right direction.
One thing about healthcare is it affects all of us. And the other thing about it is that it is interrelated to other aspects of the quality of our life and society. We can't afford not to attend to it. We can't afford to let it run away with us. So this program ought to be real instructive. You always take notes so you can do your Spensation at the end of the program. I would urge everybody to take notes on this one. This is like a short course in what's really going on, and it's profoundly important.
Well, it's time to reserve. If you haven't already, go to hvca.org and sign up today.